Okay, next up, I am delighted to introduce Katrina Holtzen, who is the account manager, Sarah's account manager from VSP. In fact, she's been Sarah's account manager from VSP to Sarah for 9 years. So, hi, Katrina, are you there?
Yes, I am. Hi, how is everybody? First, I would just love to say I love her glasses. Um,
Oh, thanks.
I'm going to share my screen here. Just a second.
They're brand new.
Yeah,
I found that I finally needed to get reading glasses.
I think I needed to do that second share, remember?
Yeah.
It's this one. Is that the one that's working?
We are seeing the edit page so far, so I think you need to reshare to the slide page.
I'm not seeing that slide page that we.
Oh, did you hit play on the presentation already?
Let me size up. Will that work?
Looks like maybe hit play from the beginning.
Okay. Slideshow from the beginning. How's that?
Great, there we go.
That looks good, doesn't it?
Yep, looks good.
So I'm thinking everybody probably knows at this point that open enrollment's November 1st to November 31st. So that's probably old news. So everybody, Sarah has a choice of two vision plans, and we'll go into the detail of what those two plans are, and also some terrific enhancements for 2023. If you've never used the benefit before, VSP before, and I'm sure you must have either through the county or through Sarah, but we encourage people to enroll online and create an account. And what this does for you is it gives you information about your plan specifically and when you use the plan last and the last doctor that you see. And it has a lot of also great information, extra information. If you ever need a doctor, you can just go on the website and find one. It's a very, very simple tool to use. And as always, VSP has never had ID cards. So just at the appointment, you tell them you have VSP coverage. They will ask you for the last 4 digits of your social, your name and your date of birth to verify who you are. And it is as simple as that. So here's a little bit of information about online, what we provide for you online, and how if you do really need to have an ID card, you could just go online and print one for you, for yourself. Sometimes it's good for your spouse to have the card as well, if it's helpful. But again, through VSP, as long as you provide the covered members' last 4 digits, you're good to go. So eye care is essential. We really push for our members to have an annual eye exam. And that is because the annual eye exam, they are not only looking at what your prescription is, they are trying to detect if there's any signs of any eye disease or conditions. And for example, on the slide, it says like glaucoma, diabetes, high cholesterol, high blood pressure. They can tell the early onset through an eye exam because it's the only vessel that a doctor can see that's unobstructed or actually having to cut into you to see. So the eyes are the gateway to the soul, as the saying goes. So getting into a little bit of the plan details on the base plan, both plans cover a fully comprehensive eye exam every 12 months. On the base plan, there is no copay for the exam. And on the buy-up plan, there's a one-time per period $15 copay for services. That means if you go into your eye doctor and you get an exam, you would pay the copay. If you decide that you want to go somewhere else to get your prescription, you would take your prescription with you and there's no further copay for that. Retinal screening, this is the map of your behind your eye. I always have mine done because it gives them a clearer view of what's going on behind your eyes. And if you have one from 1 year to the next, they have a comparison that they can see that's anything that's moving along. Here is the base plan, the buyout plan. So new for the base plan is UV coating and impact resistant lenses under the base, and new for the buyout plan is also the same. These two are covered in full. The frames, we're increasing the frame allowance. Oh, the other red highlights show the difference between the two plans, just for your reference. But what's new under both plans is the covered in full UV coating and impact resistant. That's the polycarb lenses. Those are the impact resistant, so that if you get something thrown at your glasses, they're not going to shatter.
And also the frame allowance for the base plan will it be increasing? Is that correct?
Oh yeah, it's going up to 175. I'm sorry, I think it got confusing when we were trying to red highlight everything to what was new and what was existing.
Oh yeah, no worries.
So this is your contact lens coverage. Although we have found that people, as older you get, your eyes are drier, so not a ton of usage under the contact lens, but these are the differences between the two plans if you do wear them. I struggle with them myself. My eyes get really dry and I keep using drops and I feel like I'm crying all day long. So let's see here next. Essential medical eye care. This is a relatively new program that we put into place after COVID. We wanted to make sure that people had the ability to go to the doctor for minimum medical eye problems. For example, if you get something in your eye, you could go to your eye doctor rather than go to your medical doctor. This also covers options for monitor. If you have diabetes, this program also helps monitor the progression of your diabetes. So this is your out-of-network benefit. We really try and have our members go in-network for services to get the best of the benefit. It's a greater savings for our members. But if you are in a position you need to go out of network, you would simply go to an out-of-network doctor, you'd pay that doctor, submit your claim to us, and this is the reimbursement schedule you can expect to get reimbursed. If you do go out of network, logging your claim, of course, you can do everything online nowadays. So you just log in to VSP, upload your claim, and away you go. And then we'll reimburse you then. If you ever have any questions about VSP, we have truly a world-class call center, and there are over 500 customer service reps. There's no waiting on the line forever, and they can assist you with almost any problem that you have. And if they can't assist you right off the bat, they will make sure that you're taken care of. True Hearing. We partnered with True Hearing. This is a VSP partnership. They're not part of VSP, but as a VSP member, you can save a ton of money. I am curious. I did hear that now that they're going to have non-prescription hearing aids and stuff over the counter now. So it's going to be interesting to see what those costs come in at. So it's probably more important than ever that if you do need hearing aids or hearing testing, just to do a little bit more research on that. That's brand new. I heard it on the radio the other day. And of course, we have access everywhere. We are nationwide. We do have what we call our premier doctors. These are our private practice doctors who have offered to go above and beyond our doctors, our normal doctors, and you can pick a premier doctor. When you're choosing a doctor, you'll see this premier orange sign on there, and they offer a more of an extensive frame. And of course, with VSP, you always have exclusive member extras. If you go online, you'll get the latest and greatest, but you'll always enjoy 20% off feature frames. These are the frames that we're contracted with, and there are a ton of them. So if you have a specific frame that you want to look for, chances are you get an extra $20 over your current allowance, frame allowance. And of course, we still have the 20% off any overage that you may have. So Iconic is VSP's online store. So we have all the frames online, and you can get contact lenses, and you can use this a couple of ways. You could either go to your doctor, get your prescription, go online and order your glasses online, or you can go to your doctor in reverse and tell them the frame that you want, and then they can help you with that. But it's a great tool, and it has like a virtual try on, and it's an awesome website. And of course, we have free shippings and returns if you decide that you don't like your glasses.
Katrina, with the virtual try on, is that where do you like upload your photo to it and then you can like?
Well, it has a camera and it takes data point
Okay.
base. And it's really cool because when I was sitting in front of it, I could move to the side, up and down. I put the glasses on and then move my face, and the image would move with it with the glasses.
Wow, that's amazing.
It's really cool. It's but you've got to have a camera on your computer in order to make it happen. But a lot of, by the time we get to, our age, my age, retired, you pretty well know what kind of shape of glasses that suit you best. Then you can just go online and just pick the frames that you like. So you can get as into it as you want. The young kids love it.
It's amazing. You don't even have to leave your house. You can just be watching Netflix and be trying on glasses.
As long as you have a prescription that's no older than a year, then you can upload that prescription, or put in what you need, and that will make the glasses for you, and they'll send them to you. And if you don't like them, you just send them back.
Wow, amazing.
Yeah. So that's VSP in a nutshell. I'm heading for Medicare myself, so I was super interested in the last presentation. And I was a little overwhelmed as well. I noticed one of you members mentioned that. It was a lot of information, but I was overwhelmed. I totally agree. But it was awesome information. She did a great job.
Thanks. So are you ready for some questions?
Yeah, you bet.
Okay, so there's one question. It says, sorry, I did not see the well vision screening options. Are you able to go back to the well vision slide? I actually have it.
I was looking for the plan design.
I'm not sure. She just said, I'm looking for the well vision screening options.
I'm not sure. Can we ask for clarification on the slide? Is she?
Sure. I think.
And I want maybe.
Let me just go over to that real fast. I have it open over on our website. She might have been talking about the exam, the well vision exam. So it looks like that's part of the plan design, is this well vision exam. Is that correct?
Yeah. I'm wondering if we should bring up the plan design. I have it on my system, the custom plan summary that we did.
Is that the one?
I haven't,
Let's see.
um,
If you want to share it, feel free to do that.
I'm not seeing the sharing option. Oops. Wait, where'd you go? Oops. Share screen. This one. Do you see it? I'm not
Yep.
seeing.
Yep.
I
Maybe you could zoom in a tiny bit.
I'm not seeing any options, and I'm actually not seeing.
Down in the lower right, there's a slider that lets you zoom in.
Did that help?
It didn't, it didn't get any bigger.
I'm actually not seeing it. So let me see if I can bring it back up again.
You know what? I actually have that. It looks like I have that exact same thing. So I'll go ahead and share it, and I think I can zoom in on it.
Okay.
Okay.
Perfect.
So here's the plan design, and this flyer is out on our health fair, virtual health fair page under VSP. It's the Acera 2023 plan summary.
So, and this highlights even better what the new features or what the new plan upgrades are for 2023. And it shows the 175 frame allowance, which Mike mentioned, and the 250 frame allowance, and the new UV coating covered in full and impact resistant lenses. And on the right-hand side of this flyer, which I really love, it kind of goes into some details with what you save with VSP coverage, what you save without VSP coverage.
Okay, nice. Okay, let me move on to the next question. Why are the vision benefits paid? Why are they paid less when I purchase my eyeglasses from Costco instead of a regular optometry doctor?
Okay, because Costco already has discounted frames. And so in order to make things fair across the board for our doctors in Costco, those are the, and also Costco buys in bulk, and they have a very limited range of glasses. So they're able to totally control those prices. So that's why we offer a lesser frame allowance.
Interesting. I did not know any of that.
Yeah.
Okay, next question. Is a VSP doctor different from a Kaiser optometrist doctor?
Well, that depends on what you see in the Kaiser optometry. A lot of if you have a medical condition that is affecting your eyesight, a lot of times you would go to a Kaiser doctor so that they can work within their realm of working with your medical and what you need. As far as a overall, you're going in just to have an annual exam and you've got nothing special going on, to be honest with you, I do not know exactly what the Kaiser doctor does. I would assume that they would dilate your eyes just the same if needed. I'm sure they would also offer to have the mapping done of your eyes if you wanted. But I don't have the detail for Kaiser, truthfully.
Okay. Ish, do you want to say anything about that?
No, the Kaiser, it does have items as far as it has the vision. So you can go get your eyes examined and stuff like that and select glasses there in there, but the selection is not as broad as through the sources that Via Benefits has.
VSP.
So then, of course, with my experience in taking my dad to get his glasses, some of the frames are kind of expensive. So, but you can, with our members, if you did decide to go ahead and get your glasses at Kaiser, then yeah, you want to try to coordinate with VSPS.
Yeah, and also I just want to make sure that everyone is aware, you can go to a Kaiser doctor and get your eyes examined, and you can get your prescription and then go to a VSP doctor or Costco to fulfill that prescription.
Thanks. And it looks like Yolanda wants to say something.
Yeah. So can you hear me, Mike?
Yeah, this is Yolanda Smith from Kaiser Permanente.
Yes. And in regards to the Kaiser plan, if you're on our Senior Advantage plan, we also have an optical benefit that's available to you every 24 months. So you can see the ophthalmologist or the optometrist at the copay at the facility, as well as utilizing the allotment for the optical hardware through our Vision Essentials department at each of the facilities. In regards to the VSP benefit, if you utilized it, it would not be at 100% utilization. It would be discounted. So because they are not a contracted vendor, so you wouldn't get the full access of the VSP benefit, but you do have the option of having two optical benefits. So you can utilize the Kaiser benefit and get a pair of glasses there and utilize that, and then utilize the VSP benefit through their vendors and get an additional pair of glasses.
Right, so you have the option of doing both. And also if you do go to Kaiser and you do get your eyes examined and you get your materials through them, you can submit it as an out-of-network. So you would just go online and submit your claim and you'll get reimbursed according to the schedule that I showed you earlier. So you do have a lot of options.
Great. And that actually answers the next person's question. They were asking if they should purchase a VSP vision care plan when they have the Kaiser medical coverage that includes vision services. And so, yeah, Yolanda just answered that. You can have both and you can get extra coverage.
Exactly.
Okay, so next question. Will the VSP presentation be posted on Acera? Lots of good information, but too fast to note. Yes. And in fact, it's already there. If you go to our health fair webpage, if you just go to acera.org/health fair, or you go from our homepage and click on the slider that says health fair, scroll down to VSP, and it is the first link here is the VSP presentation slides. And so you can just open that right up and check out the slides at the speed that you prefer.
And I'm sorry it was so fast.
Oh, no worries. It just gives us more time for questions.
Yeah, there you go.
So next question, and we do have about 20 minutes left for questions.
Okay.
Next question, how does VSP work with, okay, we already answered that regarding how the Kaiser and VSP work together.
Yeah.
So this person is asking, I have a VSP online account. Does it show me if I'm eligible for new lenses?
Yeah, if you go into My Benefits, it will show you what you're eligible for and when.
Okay, great. Next question, how do I apply for the eyeglasses benefit?
Are they talking about enrolling in VSP?
They might be talking, let's assume they're talking about enrolling in VSP. And if that's the case, then you would enroll through Acera. Your annual opportunity to do that is during open enrollment, which is coming up. It's the month of November 1st through 30th. And you can enroll for coverage starting February 1st. And there are instructions in the open enrollment guide. So you can go out to our homepage go to the slider that says open enrollment. It's the month of November. Scroll down to the enrollment guide, pop that open. And then it will take you through some instructions. Starting on page 4 is electing your healthcare coverage. So it will give you some instructions on how to actually make that election to enroll in the VSP plan. There's a series of steps. And one of the things it's going to tell you to do is fill out one of our enrollment forms. So if you go back to the open enrollment page and scroll down to the bottom, you'll see all of the enrollment forms that apply to open enrollment here. And so then you can just click on, if you want to use the DocuSign form like Kevin, our colleague from Acera showed you in the first presentation, you can just go ahead and click that link and you can fill out the vision plan enrollment form and submit it through DocuSign. Also, optionally, if you don't want to use DocuSign, you can download the PDF form by clicking on the PDF link, and you can print it out and sign it, and then you can email it to us or you can put it in the mail to us. Your third option would be to call us at 510-628-3000 and ask us for a paper enrollment form, and we'll mail one to you. That'll take a little bit of time. If you wanted to go on the open enrollment site today and click the DocuSign enrollment form, you could just go ahead and get it out of the way today.
Perfect.
Okay, next question. Can I get non-prescription sunglasses with this plan?
You have the option, you can, but you'll get it as a discount.
Okay. I was not aware of that.
So if you're at the doctor's office and you decide that you don't want to, that you wanted to buy an additional pair of glasses and the sunglasses, the VSP doctor will give you a discount. I believe it's 25%.
Oh, nice.
Yeah.
Okay, there is somebody was asking if there's closed captions. I'm sorry, we don't have closed captions on this broadcast. But what we will do when we upload the videos to the website, we will actually upload them to YouTube and provide links on the health fair page to tomorrow or Monday to those videos, and we'll turn on closed captioning so that you can read. YouTube has an automatic closed caption function so that you can read the captions. And I'm sorry that we don't have that available today. Next question. What is the price difference between the base and premier level? Is the chart with the prices updated online? So yes, if you go to our enrollment guide, so here I am on the open enrollment page. One way to get to the enrollment guide is to just go to that open enrollment page and click retiree enrollment guide, that button right there. And that will open up our retiree enrollment guide. And then you can see what the price differences are. So if you look at the table of contents, you can see that on page 22 is where the health plan costs start. And so you can go down to that section, health plan costs, and it will show you what there's a table on page 28, that shows you the dental and vision plan costs. So if I just enlarge this real fast, you can see what the differences in the costs are. The self-premium, if you have at least 10 years of Acera service credit, is $4.63 for the plan year 2023. For the buy-up plan, also known as the VSP premium plan, the self-premium is $16.63. If you have at least 10 years of Acera service credit, you do receive a subsidy for that of $4.63. So the standard plan is essentially free. The premium plan, it's called the buy-up plan because you have to buy up into it because we don't pay the difference between the $4.63 subsidy and the premium for the buy-up plan. So you end up paying the difference. and which is about, what is that, about $12. And that's $12 per month. Okay, next question. Can we get the question is, can we get the discount at Kaiser 2, or is that just an independent optometrist? So I guess they're wondering if they can get the VSP discount when they're seeking services through Kaiser.
No, Kaiser is a separate entity. So any discounts are strictly VSP doctor related.
Okay. And then I think you already covered this. They were asking if you go to Costco and get the same discounts. And I think you said the discounts are less at Costco. Is that right?
The frame allowance is less at Costco.
Okay.
But they also have their contracted discounts with VSP as well. So there are some discounts there as well.
Okay, great. Next question. And it looks like we have about, let's see, 13 minutes left. Do they offer contact lenses for someone with trifocal prescription?
Are you talking about putting a trifocal into a contact lens? I know they have bifocal. I don't know about trifocal. You need to talk to your eye doctor about that, because with contact lenses, a little bit different in glasses in that there is a space on your face between the lenses, whereas the contact lens is like right on your eyeball. So I would talk to the eye doctor about that. But the contact lens coverage, the contact lenses are still for the premium plan $200. So whatever contacts you get, that is your allowance. Your allowance is your allowance.
Okay, great.
That's pretty,
So
I
go ahead.
I think that's pretty brave doing a trifocal on a contact lens.
Yeah. Okay, next question.
Worked.
For your prescription for your glasses, in some cases you need your pupil distance. Is that also true with VSP? Do you know what that question is asking?
Your pupil distance?
Yeah. Oh, I see. I think they're asking on the prescription itself. There's a measurement where you would need pupil distance. So do you need that measurement, I guess, to get glasses with VSP, or does a VSP doctor provide that?
When you go to the eye doctor, I'm thinking, because I know that they do some measurements especially when you get a bifocal. The doctor, anything to do with the prescription, since that's on the medical side, not medical side, but that's in the eye doctor's realm. So the VSP doctor would handle that.
Okay. Next question. Can you go out of network for hearing aids?
So the hearing aid plan, that's through True Hearing, that we partner with them. So any questions regarding True Hearing should go directly to True Hearing.
Okay.
And the number is on that flyer that we provided.
And this is actually a good time for a little pitch for our hearing aid section of our enrollment guide. So if you go to your enrollment guide and you go down to the table of contents, you'll see that there is a hearing aid section.
Yep.
It starts on page 16. So I'll just go down to page 16. And you can see that we are summarizing all of the different hearing aid options across all of our healthcare carriers. So VSP is here. There's information about True Hearing. And in fact, there's a lot of information. It directs you to page 21. So you can get a lot more information on True Hearing on page 21. And then there's a website that you can go to there where you can access the True Hearing. But going back to that page, sorry for all the scrolling. You can see, so we've summarized all of the different hearing aid options from all of the carriers. Kaiser, United Healthcare, Via Benefits, and Delta Dental also partner with some companies to provide some hearing aid options. So there's a lot of different options out there that we our vendors are graciously making available to you all, including the True Hearing through VSP. Okay, just to confirm, will this recording be available on your website? Yes, it will. It does take some time to edit, chop this all up and edit it and get it up on YouTube. There's some time that it takes to render it. So we won't be posting it later today, but we will probably be posting it tomorrow. The very latest, we'll be posting it on Monday. And what I'll do is I will, as soon as we do that, I'll send out an email through Eventbrite to everyone who registered, so that you get a notification that the videos are ready for you to go back and watch. Let's see here. So there's and we have 7 more minutes. Is Kaiser part of the VSP network? Where do you see the list of VSP plan providers?
Okay, so Kaiser is not a part of the VSP network. You can go online at www.vsp.com. That's our website. And there's a tab that says providers. And as I mentioned earlier, let's see here. I'll wait till it comes up. Find a doctor, first one. And you can search by, as it says, like by location. So if you, wherever you're at, or if you have a doctor's office in mind or a specific doctor, you can define your search as much as you need to. And again, when you get the list, the ones with the orange Premier, those are the Premier doctors that offer a little bit more discounts.
Okay, great. I have the next question. I have Kaiser Senior Advantage, and I've never been able to get acceptance of VSP status from Kaiser when I go for an eye checkup. Is there something I can do to collect my copay?
So if you go to Kaiser and you get services, it's considered out of network. So you would have to submit your receipt, and you can do it 2 ways. You can either do it online or you can send your receipts in to us. Kaiser, again, is not a VSP. You're not going to get any information about VSP from Kaiser because we're 2 separate companies.
Yeah. Does the plan cover glasses or contacts, but not both? Or does it cover both?
It's in lieu of, you have a choice of either glasses or contacts.
Okay. Is Warby Parker now a covered provider?
Warby Parker is not. It is considered out of network. If you decide that you want to get your frames there, you get your prescription from your VSP doctor and take it to Warby Parker, and then submit an out of network, but
Okay.
In network at this point.
Okay, next question. If you don't use your glasses benefits this year, does it carry over to the next, or do you have to wait for the every 2 years?
So if you don't use your benefits stay there until they are used. So if you go in and get an exam in, say, March, you'll be eligible next March for an exam, and it would be available throughout that year for you to use the benefit. So the benefits stay there until you use them. And then once you use them, that kicks off your service period. If you're on the standard coverage and your frame is every 24 months, you would wait 24 months from the last time you used that benefit.
So if you So let's say in 2023, let's say you have the standard plan that provides frames every 24 months. And in 2023, you don't get glasses. Let's say you newly enroll in the plan and you don't get glasses in 2023. Okay, then 2024 comes around and you don't get
Still
glasses
there.
again. And then 2025 rolls around and you decide to get glasses. Can you get 2 sets because you didn't the previous 2 years?
No, it's
Okay, that's what I thought.
yeah,
So whenever you get the glasses, that kicks off the waiting period. Is that right?
exactly.
So if you got your glasses in March of 2023, you wouldn't be able to get glasses in February of 2025. You'd have to wait until you pass that March date. Is that right?
So if you get lenses and frames, because the exam is one benefit, lenses is another benefit, and the frame is another benefit. The lenses, let me just check. So your lenses are every 12 months. So you could go, so if you went in 23 and you get exam, lens, and frame, in 24, you can get exam and lenses. And then in 25, you could get the exam, lens, and frame.
Okay. But the
4 months.
the date, it really is, isn't it? I guess my question is it really a measure of 24 months? So like if you
Based on date of service. So if you
based on
went
date of service. Yeah. Okay.
2023, you would be eligible for frames again in May 2025.
Okay. Got it.
Later.
Okay. Next question. And I think we'll just take 2 more questions. And then Kaiser had requested to have a couple of minutes to set up their technology. So let me just do 2 more questions. Let me take a step back and say that just to remind everybody, there are a lot of questions in the Q&A that we won't get to, and I'm sorry we don't have time to get to all of them. But what I will do is I will download those from Zoom at the end. I'll see which questions weren't answered, and then we'll get the answers for you and we'll post them out on the health fair page as soon as we can. And we'll send out a notice via email through Eventbrite to let you know that those answers are ready. In the meantime, if you're super curious and you haven't gotten the answer to your question, you're always welcome to call the carrier itself. So if you have another VSP question, you're always free to call VSP and ask them that question. But otherwise, we'll get the rest of the answers for you and post them out on the website. The last couple of questions: will VSP reimburse out-of-pocket expenses from members utilizing a veteran's optometrist?
Yeah, as long as, yeah. If it's an out-of-network optometrist and you have the receipt, yes, we will.
Okay, great. And last question: I went to an audiologist yesterday, resulting in the need for hearing aids. Does VSP cover the cost for hearing aids?
That would fall under the True Hearing, but there are huge, deep discounts on the True Hearing.
So it sounds like they would want to go ahead and follow the link for True Hearing in our guide. Let's see, where was that? It was on page 21. Yeah, there it is. And then I'm assuming that there would be instructions on that page in order to access that benefit.
Yeah, so if you go back, so let's talk a little bit about that benefit since you have it out and there's a lot of questions. Can you go back to that flyer?
So yeah. So this is the page of our guide.
Yeah, so the discounts that we have arranged through with True Hearing being a VSP member, you can save up to 50% on hearing aids. You can get yearly comprehensive hearing exams for $75. 48 batteries. This seems like a lot of batteries to me. I wonder, is there I'm wondering if you have to switch them out a lot. I don't wear hearing aids and I don't know anyone who does. So I don't have a lot of personal experience with it seems like a lot of batteries to me. And there's manufacturing. So if you look at, if you do need to visit, if you do need hearing aids, there, Mike had showed you a bunch of different options, not just with VSP, but True Hearing, not just True Hearing, but a lot of the other vendors also have discounts. I would be looking at each one and figuring out which one would be the most beneficial.
Right. Figure out where you can get the lowest cost.
Yeah.
Yeah.
I always thought ours was really deep, but I don't know the others. And if you can get a better deal somewhere else, then yeah.
Yeah, definitely.
Mm-hmm.
Okay. So thank you so much, Katrina, for being here with us and providing your expertise on the VSP vision benefits. We really appreciate it.
Oh, you're very welcome. And feel free to send any and all questions to me and I'll respond.
All right. Wonderful. Thank you so much.
All righty. Take care.
Yeah, you too.